Hi, everyone. Welcome to IBD Complementary and Alternative Medicine in the Hispanic and Latino Community Facebook Live Chat. My name is Erica Tolentino, and I am the Senior Manager of National Operations for the Crohn's and Colitis Foundation. The Crohn's and Colitis Foundation is dedicated to finding cures for inflammatory bowel disease and improving the quality of life for patients living with Crohn's disease and ulcerative colitis. Tonight's discussion will focus on complementary and alternative medicine and its cultural significance in the Hispanic and Latino community. We know that complementary and alternative medicine is an important topic in the IBD community, and tonight we will discuss how complementary and alternative medicine impacts Hispanic and Latino IBD patients. I am joined by Dr. Carmen Paniagua, who is an adult acute care nurse practitioner in the Division of Gastroenterology and Hepatology at the University of Arkansas for Medical Sciences. Welcome, Dr. Paniagua.
Well, hello, and thanks, Erica and CCF, for this great opportunity to share some information with the Hispanic and Latino community with inflammatory bowel disease. As you mentioned, I am a nurse practitioner specialized in acute care and gerontology acute care. I'm doctorally prepared, and I have a postdoctoral traineeship in molecular genetics, and my clinical expertise is on IBD. So either ulcerative colitis or Crohn's disease or indeterminate colitis.
Thank you. So before we get started, let's go over a few quick pieces of housekeeping. Today's chat is meant for educational purposes only, and the views shared during this chat do not necessarily represent the official position of the foundation. Please always consult with your provider before making changes to your IBD treatment regimen. If you have a question about IBD that we do not get to tonight, you can contact our Ibd Help Center by emailing info@crohnscolitisfoundation.org or calling 1-888-MY-GUT-PAIN to get your questions answered. The Ibd Help Center can assist patients who speak a variety of languages, including Espanol. I would also like to thank our sponsor, Genentech, who made this live chat possible. With that said, let's get started. So we know that complementary and alternative medicine is a hot topic for IBD patients, but many individuals are not familiar with what that term means. What exactly is complementary medicine, and how can it help IBD patients?
Well, Erica, this is a great starting question, mainly because complementary and alternative therapy has been used for quite a while, and our inflammatory bowel disease patients are using it as well. So to answer your question about complementary medicine, these are techniques or methods that are used with the regular or the established already standard medicine that we use. So this will complement the standard medicine that you're using at the moment.
Okay. Similarly, what is alternative medicine and how can it help IBD patients?
So on the other hand, alternative medicine are methods that are used instead of the standard medical approaches that we use. We usually, these methods, either the complementary or the alternative, can help any patient, including our inflammatory bowel disease patients, because it can bring improvement in certain quality of life parameters. For example, it can reduce the pain, it can reduce the anxiety and the stress that the patient has. Also, it can heal faster, like wounds, and it can reduce the amount of nausea that some patients have, and also will increase to a certain extent the mood using any of these methods.
Wonderful. What are some examples of complementary and alternative medicine that can be considered for IBD patients?
Well, there are plenty of them, but I'm going to try to focus on the Hispanic and Latino patients, they're usually used, or we usually, because of course I'm Hispanic as well,
Mhm.
we usually do vitamin supplements. So vitamins, we know that it will affect in inflammatory bowel disease patient, it will usually affect how we absorb the nutrients. Therefore, taking supplements, it's sometimes as a complementary therapy for IBD to replace those vitamins and minerals that we are deficient. For example, a patient with Crohn's disease that have also ileitis or inflammation of the terminal ileum, which is a small portion of the small bowel, their absorption to B12 will be limited. So that could be an example of how we can replace that B12. However, remember to consult first your healthcare provider before you start any of this alternative or complementary therapies. Another hot topic these days is the probiotics. Probiotics is a very good example of this therapies. They are a form of good bacteria that can help to maintain the balance in your intestine of the good and the bad bacteria. They also keep the harmful bacteria from overgrowing, therefore causing digestive issues. Evidence suggests that the use of probiotics can help people to maintain the remission of Crohn's, but these are limited studies that are in our armamentarium. Also, probiotics may help to prevent a condition that is called pouchitis, which is after an intestinal surgery that creates a pouch. So this has been already, it's a good alternative for those patients that have an inflammation of the pouch, the use of probiotics. Again, always remember to consult with your healthcare provider before starting any of these.
Okay.
A
Wonderful.
good one, I only have like a couple more, so y'all can be very informed about it. The one that it's kind of like avant-garde these days is the turmeric or curcumin. Turmeric has very good anti-inflammatories and antioxidant properties that can be used. They're used, and you can either sprinkle them in your food or you can take the pill form. The only thing is that you will need, and we don't know how much milligrams of it, you will need a certain amount in order to acquire those anti-inflammatory and antitoxin properties that this turmeric has. Now, on the other hand, turmeric in some cases can cause symptoms like bloating or diarrhea. So we have to be careful about. We as Hispanics and Latino use also aloe vera, which is very common in our communities. And it got a very good reviews for all people that have ulcerative colitis. You have to be careful though, because the aloe vera juice, that is the one that's more available in the store, has a laxative effect and therefore will cause problems for people that already have diarrhea. So watch out on those. So the component of the aloe vera that has that laxative property is called also aloe latex. So watch out for that. Now, do remember that aloe products are not FDA approved. Therefore, it can be harmful in other situations. And another one that's a hot topic these days is the famous cannabis. So, or marijuana. Cannabis, the medical marijuana, is derived from a plant that is called cannabis sativa. It has been used for centuries for different illnesses, in numerous of them. but it contains more than 70 different cannabinoid compounds. But the two most popular compounds are the cannabinoid and the THC. There are several large survey studies based in the US that shows that patients that use cannabis to treat IBD symptoms can improve their quality of life in one hand. But remember also that the use of cannabis have regulatory federal implications as well as psychosocial implications too. There are no research, randomized control study research that points to for the marijuana to be beneficial to either induce or maintain remission for inflammatory bowel disease. Therefore, I personally, and we all, do not recommend the use of cannabis to treat or as an alternative to supplement any of the current inflammatory bowel disease medications that we usually do. So a few other more that we use is the acupuncture. And acupuncture has been used in Chinese medicine forever and involves the placing of little teeny tiny thin needles around certain acupoints that some people are really scared about, but it can be useful in reducing both inflammatory and reverse tissue damage. Aside from a little bit of maybe bleeding or a little hematoma, it's basically safe to use. Always look for a professional in that area. And lastly, I found in our research for Hispanic and Latino IBDers that they use mindfulness techniques. What are these techniques that we practice? For example, yoga, meditation can also be beneficial due to the fact that they reduce the stress, which could flare up your inflammatory bowel disease. Also, you can find yoga classes anywhere in the community
Definitely.
center. You can find it online. I bet you that you use it too. You
On YouTube,
yeah,
you can find all your classes.
Exactly. You go to YouTube. They are very affordable. You don't have to belong to a gym to go and do this stuff. So these techniques can really improve your quality of life. And for those patients that are suffering from a flare-up, it can help them decrease the pain.
Well,
That's a lot in a heartbeat.
So much. Yeah, this is great information. I've just learned that I could use turmeric for a whole bunch of different things, and definitely going to have to take a look at the aloe juice I have in my refrigerator because I love me some aloe juice. So thank you so much, doctor. How can complementary and alternative medicine be integrated into, these holistic treatment plans for, our Hispanic and Latino IBD patients?
This is a very interesting question because we have to take in consideration or understanding the extent and patterns of complementary and alternative medicine and their use in different or multi-ethnic patients, not only Hispanics. There are different cultures, so we really have to integrate this in a holistic manner. So different ways that we can do this is by initiating and encourage an open talk with our patients, and just do an honest discussion between your provider and yourself, in mainly if you're using any herbs, for example, or any supplements, then do a very good history of the drugs and herbs that the patient is using, inquiry about this dietary supplements that sometimes, our patients are using. Pharmacists also can integrate this by giving information about the effects and interactions of herbs, for example, with prescribed medication, that there are a few that have interaction. So we have to be careful with that. And of course, more continuing education programs and drug information resources that are available for the consumer or for the patient, as well as for the healthcare provider.
Oh, thank you. And are there any concerns regarding complementary and alternative medicine that Hispanic and Latino communities should be aware of?
Yes, they are. I think that number one should be safety. How safe, the safety concerns are really important. Remember that none of these alternative or complementary therapies are very well researched. They're not. So you have to consider the safety of whatever the method or technique you're going to start with. Also, the efficacy and the dosing of the medications that you actually use, if they interact or not with it, which is very important. Ensure we as Hispanics and Latinos, we have to make sure that the person that we go for this care, it's a professional, it's a reputable person, not because, Minga from the square, over there, or Lolita that all their life has done this before, have an expertise. You really have to do the front end of the inquiry to make sure that it's proactive, or that practitioner is trained in whatever you're gonna do. Again, I have to stress the importance that the research, the scientific research for this methods are minimal. Okay, so sometimes these treatments, these alternative and complementary therapies will take longer than usual, or they usually take more than 6 months in order to create some good effect. This also, you have to make sure that these are not to be used during any emergency. Don't drink the aloe vera if you're in the middle of the flare-up, okay? Because that ain't not gonna work. Okay. And also you have to be aware that none of these things are FDA approval. So if your turmeric says that is 3,000 milligrams, you don't actually know if there are 3,000 or 1,000. So those are the things that I will think about, that we as Hispanic and Latino have to make sure.
Yeah, definitely being mindful of the dosages, and we don't know how certain things are going to react to our bodies as well. So thank you so much. And the foundation always recommends that patients consult with their physicians when making any health decisions. What type of healthcare providers can help Hispanic or Latino IBD patients decide if complementary and alternative medicine is right for them?
Well, Erica, I think that any healthcare provider can help patients to decide which complementary or alternative medicine will work or is right for them. The first step will be to just open the door for discussion with, our patients, or the patient with the provider. This will give us an opportunity actually to improve our understanding of the daily symptoms affecting the quality of life of our patients, and the treatments that our patients are using in order to control their symptoms and improve, of course, their quality of life. Once the conversation has started, then the opportunity to educate our patients, as well as to educate ourselves in the knowledge or the lack of knowledge that we as providers have regarding complementary alternative medicine, mainly in inflammatory bowel disease. I will add also that understanding the rationale, the motivation, and the history of the Hispanics' use of complementary alternative medicine will enhance the cultural competence of us providers or healthcare providers and help address this patient's medical needs, because it's the only way. Because, for example, if we don't know what a curandero is at this time, how can I help my patient that is going to the curandero for their medication or their alternative therapy? What about my Puerto Rican colleagues that we go to the botanicas to get the herbs from there, but have to make sure that they will interfere with other medications that I'm taking. If we as healthcare providers don't understand, for example, espiritismo or santeria or all this centuries of integrating, they're rooted in a long history. So it's very important for us to understand, and for healthcare providers that are not Hispanic or Latino to understand.
Definitely, of course. We still make homemade cold medicine with my family. So it's definitely important, and there is a wealth of information on this topic, but we want to ensure that patients are receiving, the proper resources and, information on this. Where can patients go to research and learn more about complementary and alternative medicine?
Please don't consult Dr. Google. I mean, there are more reputable sources than Dr. Google. So I will say that the first and foremost will be the National Center for Complementary and Alternative Medicine, which is funded by the National Institute of Health. And of course, you can Google the address, that will be fine. But again, it's the National Center for Complementary and Alternative Medicine from the National Institute of Health. Also, you can report any kind of problem with your medication or any suspected side effect to the FDA, which is the Food and Drug Administration, MedWatch, and they even have a 1-800 number, and you can report that. There's also a couple of other resources like the American Board of Holistic Medicine and the American Holistic Medical Association. There is the Center for Mind Body Medicine, that will be another, or the consortium of the Academy Health Center for Integrative Medicine, which actually they integrate all these therapies and methods in order to be more helpful for the patient.
Wow, thank you. This is super helpful for me, and I'm sure for everyone who's listening to today's live chat. And really, that is all the time we have for tonight. Thank you, Dr. Paniagua, for taking the time to share your expertise with us about the role of complementary and alternative medicine in treating IBD patients in the Hispanic and Latino community.
Again, thank you very much. And I just want to leave our viewers with this last remarks that remember, complementary and alternative medicine use is very, very common, and we need larger and well-designed studies involving Hispanics and Latino populations to validate whatever the method or technique for complementary or alternative therapy will be, in order for us to incorporate with the traditional treatments for IBD that we have. So it is very important for those healthcare providers that are as our viewers to ask the patients about the use of complementary or alternative therapy. Ultimately, the goal of all this should be to recognize complementary and alternative medicine as having a potential supplemental role, but not as an alternative one to the conventional armamentarium for the treatment of inflammatory bowel disease.
Well, thank you so much for your time tonight. And thank you to everyone who joined the live session this evening. We are asking everyone who joined to complete the brief evaluation in the chat. We value your feedback and use this information to create future education programs. Additionally, if you enjoyed this session, we hope you will consider sharing a recording of this chat with other members of the IBD community, including your healthcare providers. The recording will be available on our Facebook page and YouTube channel. While you are completing the brief evaluation, I wanted to share some really exciting news. The Foundation is thrilled to announce that we have launched a new website for the Spanish-speaking community. This is a place where individuals can receive information and resources about IBD. To visit this site, you can go to www.crohnscolitisfoundation.org and click on En Español on the right side of the screen. So please, I hope you are all as excited as I am that you'll be able to see everything now in Spanish too. As a reminder, our Ibd Help Center is available to answer any questions you may have after tonight's chat. You can contact our Ibd Help Center by emailing info@crohnscolitisfoundation.org or calling 1-888-MY-GUT-PAIN. The Ibd Help Center can assist patients who speak a variety of languages. And again, thank you to Genentech who made this live chat possible, and a huge and special thank you again to Dr. Paniagua. Thank you for joining and have a great evening. Buenas noches, everyone.
Buenas noches.